when we were first hearing about this virus, it was deemed not a virus of children. And the children were thankfully spared early on during the first wave, several waves of this pandemic. Some would get mild colds, but it was really very rare. There was a rare disorder called MIS-C, which is an inflammatory syndrome of children related to COVID that we were seeing. But really, the devastation in children was extremely low. And frankly, I think worldwide, this would have been handled very differently if it began as a disease of children, such as something like polio or smallpox. That said, here we are now, and we're seeing children fill our ICUs, fill our urgent cares, emergency rooms. Parents are terrified to send their kids to school. And, I think because there has been so much misinformation regarding vaccines, regarding COVID safety, regarding what we need to do to protect each other, protect ourselves, that now, unfortunately, yet again, the children are suffering. Last year, they suffered by having to, certainly in the States, the majority of children were home for the past 12 to 18 months on their computers at school, which was really, really a hardship on many children. And now they're suffering because they're getting sick. So, it's a real loss to these kids. It's a real shame that they're having to go through this. And a lot of kids are aware enough about this virus, even young kids, that they're scared as well. It's not just that their parents are scared. A lot of these sort of, I'm going to say clickbait, but there is a little bit of headlining with a lot of new information, especially for something like a vaccine or a medication, to reduce the progression of dementia. I mean, these are worldwide problems, and if you read a headline that there's a potential cure or prevention for these, the human nature is going to be to jump at that. But I always say, and this is what I've talked about in my writing and my speaking and my books, is whenever you hear something that's too good to be true, and we learn this all the time, over and over again, it probably is too good to be true. Nothing is going to all of a sudden be so groundbreaking that the world will change and health will be different, that any sort of news break or groundbreaking scientific information, there's always going to be a caveat to it. So I think that, if people were able to sort of read through some of the headlines and sort of cull through the reality of what's offered, I think the expectations will be a little more realistic. Not necessarily that you should all be skeptics and not believe anything you read, but just, to be a little bit skeptical and to be a little questioning initially before just assuming that everything is what it is, whether it's good or bad. If I didn't have a glimmer of optimism every day, it would really be tough. So I always try to look at the positives every day. I do look at, that more people are getting vaccinated on a daily basis, and at least in this country, that, so people are now, certainly in the last 4 weeks or so, turning the corner on considering getting vaccinated. So I think that's a really positive sign. I think people do understand the potential dangers of this. And I think that, there are people out there, and hopefully more people than not, who do care about each other and do care about our society and public good and public health, and understand that this is not just for me or for you, but this is for everybody. So, I at my work, seeing patients, I see wonderful people every day. I see kids every day. So I always sort of look to them as our future. Kids are smart and inquisitive and understanding, and care about each other and care about their world. So, I think there's my optimism, is just seeing that on an individual basis every day.
Got nothing left to give from a day of chasing dreams, settle